I think the healthcare industry is going through a lot of change right now. I think it's still a very strong growth opportunity. We see the Walgreens, the CVS's, the Walmarts looking at where do they fit in this healthcare sector. We saw CVS actually change their name to CVS Health. So again, as we look to the healthcare sector, it's going to continue to grow, continue to see how you meet the needs of the consumer. I think we are moving in a time from a patient concept, hospital-centric, to more of a retail consumer environment. One of the reasons, again, that Baylor Scott & White merged was that we believe we truly could transform how healthcare is delivered in this country. It's an ongoing process. It's a journey. It's a marathon. It's not a sprint. And we believe we're well into that transformation. I think it's part of the continual change that we see. I've told people that I've been in healthcare for over 40 years, and this is the fastest rate of change I've ever seen. And I think it's important that we continue to be sure we are changing in the right way and truly transforming how people receive their health care. What we wanted to prove was that we could, through this merger, continue to show that we can improve quality and safe care and do it at an affordable cost. We see disruptive technologies coming in and other industries getting into healthcare and starting to align with the consumer and the patient around healthcare. And so you've got to continually change. And plus, it's a very competitive environment, and particularly in Texas. When we think about taking on risk, and we look at it in a variety of ways, one, we will be taking on more risk as it relates to payment because we see the payers, the employers putting more and more of the risk on the providers. And so when we think about taking on risk from a financing standpoint, yes. And of course with the health plan and with the Quality Alliance, we will be taking on more risk. When you think of risk in the terms of trying new ventures, trying new models, I think we have to do that. I think that's part of our responsibility to say, how can we better meet the needs of our patients and our communities? So you're going to have to take some risk on how you're going to do that. And you have to do it in what I call a calculated way. It's got to be a strategic risk. And then you have to look at how do you mitigate that risk. And at the end of the day, you're going to say, yeah, we're going to take on some risk. We're going to do some innovation. We're going to do some exploring. And we're going to try. And I think what we'll do a lot of is what we've been doing is we'll pilot some different models and pilot some different partnerships to see how we do as we go through this change process. I think as we see industry evolve and they look at what other areas do they go into, I think it's going to come back to some of your basic mission statements and your values of what you ought to move into, and does it help you meet your mission by moving into that particular industry. We knew we had to move into the financing of health care. A lot of times people look at that and say, is that right for us? Is that appropriate? Well, we believed it was the right thing to do. And so we moved into where we now have a health plan as a part of our integrated delivery network. People are looking into, do they go into the retail side of health care? Do they put in models that really work with a CVS or a Walgreens or a Walmart? And should they do that? And we believe, yes, you should look at going into that space because that's going to be how you grow as an organization. Retailing. We ought to be looking at how do we do better at retailing this to meet the needs of our consumers and to stay engaged with them. And there's a great amount of population out there that are healthy. They're the young ones, the invincibles. How do you stay in touch with them? You may have to have relationships with fitness centers or offer wellness centers across an area so that you have them engaged while they're healthy and work with them. And then when they move into an area where they need some type of health care specifically delivered in a model of a hospital or an outpatient facility, they are engaged with you. You have got to be able to adapt to a rapidly changing environment. And I think that calls for creativity. It calls for a willingness to look at change. I think it also causes you to look at as you adapt is to try to be ahead of the curve. I think leaders are going to have to really be visionary, and one of our strategies has always been to learn faster than our competition. And you have to, I think, adapt to that without giving up your values, giving up your mission. I think it was Abraham Lincoln who said the best way to predict the future was to create it. Well, at Baylor Scott & White Health, that's why we came together, because we want to create the future and create this new model of care which will actually transform how health care is delivered in this country. And so I think it's just an exciting time. It's one that you find invigorating, because we can create something that's never been created before.